Welcome to Boss Equity video podcast. It's my pleasure to introduce a specialist in the healthcare software market, Roger Wallhouse. As the NHS turns 70 in May, this is a very timely period to look at the changes within government healthcare bodies such as the National Health Service here in the UK and how they're grappling with all the drivers of increased aging population, the rise of mental health, the need to integrate with social care, while at the same time managing huge cost considerations and inefficiencies to provide the best health care for patients worldwide. So, Roger, it's a pleasure to have you here, and as many of our new listeners may not have read our article a few months ago when we first met here, perhaps we could start with a brief summary of your background in this sector and the role of your company, HealthSet.
The background is that I trained as an engineer many years ago, and I confess that with the NHS at 70, I was alive when the NHS was formed. But I got into computing quite early, when computers were the size of hotel rooms, and the idea of having computers in healthcare was relatively new. So my real engagement with the NHS started in about 1978, and the first 20 years from about 1980 onwards was spent with an organisation across the US and progressively across Europe and elsewhere implementing electronic health records. Since the late 1990s, I set up my own consulting business, primarily to support small companies engaging in the health market. And so through that process, I've engaged with numerous companies. I've become directors and chairman and so on of those various companies, and that's where I am today.
As a pioneer of one of the earliest electronic EHR health record systems here in the UK, how has the adoption of EHR changed, particularly over the last 5 to 6 years? And how achievable do you see it reaching this goal of fully digital healthcare records in 2020?
Well, take that point first, okay? It won't happen by 2020. I think that's a political ambition, and you've got to have that kind of ambition to drive a program. But I think if you compare the NHS with any other business enterprise, and the NHS is a business, you find that it is much slower in the adoption of technology, and there are reasons for that. But in terms of electronic health records, what's constantly misunderstood by those outside the NHS, and I think the politicians as well, is the complexity of healthcare data and the complexity of the organisations that are using those kinds of technologies. So I don't think 2020 is a realistic ambition, but I do believe that in the last 10 years, okay, despite the fact that there's been some false starts, progress is now being made, and being made more rapidly than it has been probably in the past 30 years.
We also discussed another key area, such as the purchase and tracking of hospital assets. I recall you did some research on this area into revenue leakage caused by such inefficiencies across the procurement and supply chain within the NHS.
Sure.
What were your key findings from this research that you did?
Yeah, I got involved in this because I was asked maybe 5 or 6 years ago to look at what was happening in Scotland in terms of supply management and procurement as a comparator to the NHS. And along with a colleague, we produced a report which showed that in many ways, although Scotland is obviously much smaller, it is ahead of the NHS in the way that it has addressed the supply management chain process, and did provide, I think, something of a catalyst for what took place subsequently. So about 2 years after that, the Department of Health and NHS England adopted a programme led by Lord Patrick Carter to look at the whole issue of NHS procurement, but that turned into a look at NHS efficiency. And of course, the NHS was considerably found wanting in that department. And I think again, looking at the background, is during the Blair years of government, when the amount of money that was made available to the NHS grew considerably. What is often forgotten is that a lot of that money was just consumed, in fact, most of it was consumed without any improvement in efficiency. So when you come to look at assets in the NHS, what you see is that in terms of their purchasing programs, in terms of the way they manage supplies, much of that is still paper-based. The NHS does not buy effectively, and in part that's because of the most recent Care Act of 2013 gave autonomy down at the local level. So the NHS is well known for not using its buying power that it could do. Although there are units within the NHS where there's a sort of collective attempt to get best price, they're still a long way from that process. But the more important thing, I think, is that the Department of Health has funded a program which is called Scan for Safety, which is really about the adoption of barcoding, GS1 barcoding, to assist in supply management and identification, and to try and bring a standard and to try and bring a commonality across the NHS so that it can at least start to move down that process. But they've got a long way to go, and it's a real opportunity.
Great. Do you see any other areas pivotal to managing operational costs and enhancing quality care? I mean, around about resource management of staffing and bed allocation and things like this?
Yeah, the NHS, as you know, is a huge organisation. And I think anybody coming from the outside, particularly those coming from a non-UK base, will tend to view the NHS as one organisation. It isn't. The NHS, I think, has been well described as a brand. What you have is you have hundreds of different fiefdoms, all essentially doing their own thing within a framework that is the NHS. So again, one of the other issues that the NHS faces is that whilst it is a public sector body and you have politicians therefore acutely involved in the running of the NHS, at least at a political level, the levers that they control aren't connected to the operations on the ground. So the fact that someone like Jeremy Hunt makes a decision in terms of this is the way we would like the NHS to go doesn't necessarily mean that will translate into action on the ground. So are there lots of actions that could be taken? Yes, there are many. And I think for anybody looking at the NHS, particularly suppliers, either looking to increase their position or to move into the NHS, they need to recognise that, first of all, you're dealing with autonomous units that have their own particular requirements and needs. But against that is a political backdrop that is about closer integration of services. So the movement towards accountable care organisations or accountable care systems is a direction of travel. Now, there are some barriers to that happening, but nevertheless, the integration with healthcare and social care has to take place. It's a model that is well adopted across Scandinavia and in some other European countries, and I think it's now more globally accepted that unless you get that integration, you're not going to deal with the efficiencies in healthcare.
Yes. With the cyber attack on the NHS last year, clearly security and data protection issues also need further investment. What impact do you see areas like GDPR, which is another milestone that's meant to be being reached this year, have on this sector?
The whole data security issue is a massive issue within the NHS. And it's a massive issue because at one level there is protection of personal data. So patient data is deemed to be sacrosanct, that it can't be let outside the country. So primarily it has to be stored in the country. We'll come on to cloud-based systems later. But for some years, there has been a requirement in the NHS for all trusts to have what's known as a Caldicott Guardian. Dame Caldicott, who is the, if you like, the instigator behind this, has been given the task by government to set the standards for managing data. So these are quite rigid, and in certain areas they can be quite onerous from a supplier point of view. Having said that, there is a recognition now that for better patient care, data must be shared. But it must be shared, obviously, in a secure manner. Typically, suppliers have to work within the NHS network. So if you're on the inside, then the data is to some extent protected from it coming outside. But secondly, with the advent of GDPR, I think the NHS is awake to it, and there are no doubts that some trusts have actually taken it very seriously and have put all the necessary actions in place. But I think as the date looms, the full magnitude of what it could be for them hasn't been realised, because in theory, any one of us can ask the NHS for every piece of information that is stored about us. And the NHS has no way of responding to that.